Hello and welcome to Medicare Made Easy. This is a broadcast from Blue Cross and Blue Shield of Louisiana designed to help people understand their Medicare choices as they age into the program. I'm Mike Berto. I'm a healthcare economist with Blue Cross and Blue Shield here in Louisiana, and I'm really blessed to have with me today Tress Faraday, who is an expert on all things Medicare, who's going to take good care of you as we go forward. Tell them a little bit about yourself, Tress.
So hi, I'm Tress Faraday. I'm here on the Medicare sales team. I work with the folks that are here to answer all your Medicare questions. I know it can be overwhelming and a lot of new information that you perhaps aren't familiar with. So we're here to hopefully answer some of your questions as you're going to make your Medicare decisions.
Thanks. And as we go through this broadcast, you're going to hear me say this over and over again. There are many choices when you're moving into the Medicare program. It would behoove you to use an agent, someone who's already done this before, somebody who's really got a feel for what's available and is required to keep up to date on all your Medicare choices as they go forward. Tress, I know Medicare has parts, a lot of letters, A, B, C, D. Can you kind of clarify some of that for us?
Yeah, some folks may hear about the Medicare A, B, C, and Ds. So let's talk a little bit about them. Medicare A is for your hospital coverage. And then the Part B is for your medical coverage and doctors. So those two pieces are what you may have heard called original Medicare. And some folks use that. Now with original Medicare, they're going to cover 80% of your costs. And so that means 20% of the costs would be for you. So that's something to be aware of. You've also maybe heard Part C. So Part C is what's called Medicare Advantage. Many Medicare Advantage plans combine the Part A, the Part B, and they might even have what's called Part D. So that would be prescription drug coverage. So on a Part C plan, you could get things bundled together, whether it's dental and vision and fitness and things like that. And then, as I referenced, Part D is for covered drugs, your prescription drug coverage. So those are the A, B, C's, and D's of Medicare.
Now, Tress, it seems to me the fastest growing part of the Medicare program right now is what you just described as Part C or Medicare Advantage. Can you give us kind of a synopsis of the benefits of using Medicare Advantage versus using traditional Medicare?
Well, so I mentioned if it's original Medicare and it's just the Part A, Part B, 20% of those expenses could fall on you. And so that's something that folks need to be aware of. On Part C is through private insurers who administer your health benefits on behalf of the federal government. It's called Medicare Advantage, and it can combine all those parts together. So you have your doctors, your covered drugs, you could have fitness, dental, vision, other things are combined. You'd have one member ID card and one entity that's offering you your healthcare options. So some people like the simplicity of it. I have one entity to work with. I don't have multiple things I have to keep up with. They can help me make sure my doctors that I want to see, I can see my doctors. They can help me make sure I get my drugs, the covered drugs that I'm looking to have. So a lot of folks enjoy just the convenience of that bundled, combined plan.
You know, as a person who's approaching 65, I'm only a few years away. I totally see the benefit of having all of that coverage in one document, all in one place. So if I had a problem or a question, I could go directly to the same place every time. That's an exciting concept to me rather than having it scattered all over.
Right. So what you do is call the number on the back of your member ID card, and the folks at that number, whether it's a claim question or a doctor question or any kind of questions, that one location could kind of look up your claims, look up what's going on, kind of give you guidance on what to do. So there is some simplicity to that. If there's one location, it is all administered for the federal government. So it is Medicare administered on behalf of the federal government. So you would get at least all the benefits that original Medicare would offer you, plus a whole lot more.
You know, as someone who's been working for a Blue plan for almost 20 years, everybody knows me. Everybody knows that I work for insurance companies. So as they're aging into Medicare, I'm the one that gets a lot of phone calls. You know, what do I buy? What do I do? And I'll tell you, I've got the best bit of advice, and I'm going to share with you today, that advice. And that's to focus on, before you pick a plan, the 3 Ps, right? Number 1 is your provider. The last thing you want to do is to go into Medicare and have to change doctors. So before you pick a Medicare plan, make absolutely sure that your doctor, your favorite hospital, whatever clinics you use are in the network of that health plan that you want to pick. That's the first P. The second P is prescription drugs. By the time most of us get to age in for Medicare, we're already on a couple of prescriptions. And the last thing you want to do is pick up a new kind of insurance that doesn't cover drugs you're already on or doesn't cover the pharmacy where you get your drugs most of the time. So that second P, pharmacy, make sure that whatever plan you select accepts the insurance that you want to use at your pharmacy, covers your drugs, and you should be able to find out your copays and coinsurance ahead of time before you select a plan. And then that third P, I just call perks, extra benefits. The Medicare Part C plans, Medicare Advantage, traditionally have new benefits that go beyond what we would think of as traditional health insurance. Can you give me a hand with those? Tell me a few of the things that our Part C plan would provide.
It depends on the plan, what plan you choose, but they can offer no-cost fitness. They can offer wellness rewards. So there's some options if you're keeping up with your health, you're getting your doctor visits. There could be some options there. Some plans offer, a give back, a Part B give back. So we talked about the parts of Medicare, and so there can be a premium cost on your Part B. And so some plans offer that. So it really varies on the plan you choose, but there can be those kind of extras and a little more and a little this. Now, as you mentioned, the 3 Ps, what we don't want you to do is you see one of the extras and you sign up for a plan because we don't want to get distracted by the one extra. You want to make sure, okay, what doctors do I need to see? Do I need to get my care close to home? And maybe I can get a plan with a narrower network and maybe I'll see some cost benefits of that. Or you know what? I need nationwide coverage. So I need to make sure when I travel, I go visit friends or family, and I need to see a doctor, I can do that out of state as well. So those are that's why when Mike brings up the 3 Ps, it is important. I can see my doctors, I can get the covered drugs I need, and there's some extras as well.
Yeah, that network piece is the thing I think people forget about the most. And it's critical because you don't want gaps in your care, you don't want interruption. So please, before you select a plan, make sure your docs and your pharmacy accept it and it covers the drugs that you need. The other thing we've run into over the last couple of years, sadly, is that some people are going to extraordinary efforts to try to separate you from your money. And what do I mean by that? Well, we've had problems with scams and fraudsters who want to prey on seniors. The one we've run across lately is really insidious. They grab phone numbers that are 1 digit off of our customer service number. And then when people call that line, there's someone there trying to get a credit card number out of them. Oh, if you give us the number now, we'll give you grocery discounts, or we'll give you a gift card, or we'll give you something immediately. And I can promise you, if you're being asked for a credit card on the phone and they're promising you an immediate benefit, that's not us, right?
Right, no, that's not us. So I know, unfortunately, fraud is just a way of life currently, and they're going to try to get in touch with you. And if there's a sense of urgency, if it sounds too good to be true, it probably is. Now, will we sometimes call you if you're a member on our plan? Yes, potentially we might call you. But if we're calling you, maybe we're offering you a service because you have a chronic condition, or we're offering something. There really shouldn't be this kind of sense of urgency. We shouldn't be asking for a credit card. If you get a call and it sounds strange, hang up. Don't worry about being rude. Just hang up the phone. And what you can do is look at your member ID card on the number on the back and call, and you'll go back to customer service and say, hey, was someone trying to get in touch with me? And if it was us, they'll say, yes, actually, this department is trying to get in touch with you. I'll route you to them. So don't worry about kind of keeping them on the phone or answering their questions or what have you. Go, this sounds strange. I'm hanging up. This is done.
Yeah, the last thing you want to do is to give that kind of information to someone without making 100% sure you know who they are. And so I love the idea of just calling customer service right back. And that way you can verify that it was us the whole time. Great idea. Sadly, it's the age we live in. There are people trying to take advantage of seniors, and we want to do everything we can to give you all the information we can so that you don't get taken that way. The last thing I want to say is I want to encourage you when you want to make this decision to use an agent. We have highly qualified, brilliant people out there who are studying year after year every plan and every permutation. And you can reach them very easily. You can see the phone numbers on the screen, 1-800-568-1417 will put you in touch with an agent. Or you can go on the web and use bcbslaplan.com/Medicare. Either of those will get you to an agent, and they will guide you through this process and keep you from buying a plan that doesn't meet your needs. And we're all in for that.
Right. That's definitely important. There's no cost or obligation to talk to an agent. And ultimately, as we're, later this year, from October 15th to December 7th, is going to be open enrollment. So you're going to get things in the mail. You're going to see television commercials. It's a lot of information. It's going to be very overwhelming. And so what you want to do is work with a licensed agent who's certified in Medicare and find the plan that fits you. It's good to talk to family and friends, what's working for them, but also what are your conditions, health conditions. Make sure the plan fits for you. And so you don't want to feel pressured, but to have someone help answer your questions, determine your timing. When are you going to retire? Are you retiring at 65? Are you going to work a little longer? Does your employer have what's called credible coverage? Are you going to be able to continue on their health care and it's deemed credible coverage? You can talk to their benefits specialist and find that out, because I'm sure you're not the first person who was continuing to work at that company. And then you'll know, then also you can ask them, is there going to be group retiree coverage with your employer, or are you going to be pursuing individual Medicare on your own? And so what happens, there are some folks who maybe through their employer have group retiree coverage, but they see some of the TV commercials and they call the number and they'll try to enroll them, and you don't want to disrupt your group coverage. You do not want to, if you have employer coverage and it may continue as a retiree, don't call one of those numbers, those TV commercials, and kind of start messing up with your coverage. Go to your employer, make sure you know what your options are. And if you're on your own, then you're going to be pursuing an individual Medicare option.
So if I'm going to work 65 and older, I really should start this process with my human resources, my benefit advisors at work, to find out what their offers are and how that might interface with an MA plan or wherever I'm going to get.
Right.
Not just jump to the first commercial I see on
Correct.
TV.
Because you want to make sure you understand what your options are or are not. And maybe you are on your own and you have to do research, but once again, the dates and the timing matter. If you're 65, you're going to want to opt in for your Medicare Part A. Most have premium-free Part A because they've worked their 40 quarters. They've been contributing to Social Security taxes. So you would opt in for that, but not necessarily have costs associated. When it's time to get your Medicare Part B, there can be a premium. Most folks have a premium. Some folks maybe get access to extra help. The best person to kind of go through and ask these questions is an agent, because they can help you look at your timing, understand what your options are, understand what potential expenses you would have through premiums and such, and really help guide you. And so you can start taking notes and determine your timing. Yes, I can continue to work. Yes, I have credible coverage, or no, I don't have credible coverage. Because if you don't have credible coverage, later you may get a penalty, and we don't want you, and that would be from the federal government. We don't want anyone to have to go down that route. So knowing this information in advance and knowing your dates and your timing and what to do next is very helpful. And yeah, once again, no cost or obligation to talk to a licensed agent.
As you can see, this decision could be a little bit complex. And I know we've thrown a lot at you guys today, but you should feel free to get your questions answered, right? At 1-800-568-1417 or online at bcbslaplan.com/Medicare. I think that's going to do it for us today. Tress, thank you so much.
Thank you
for joining me today. This has just been so enlightening for me as well. And I hope all of you out there have learned something from us today. We're here at Blue Cross. This is Medicare Made Easy, and we'll be back in a few weeks to do another one just like this.